all that stuff. It flexes the big toe. What's the word for big toe? Starts with an H. Yeah.
Flexor hallucis longus.
Yes! And then what's the one that flexes the digits?
Digitorum.
Yeah, so flexor.
Flexor digitorum longus.
Yes! And then what's the muscle found on the back side of the tibia? That goes underneath, hooks on the bottom foot. Back side of the tibia.
Tibialis.
Bacchus.
Posterior.
Yes! Tibialis posterior. Okay. You're going to need to go to 4 more months of school. But that was very good. No, I'm kidding. All right, so moving on up the leg. Moving up the back side of the leg. We're down in the femoral compartment, the posterior femoral compartment. What are the 3 muscles back there?
Semimembranosus, semitendinosus, and rectus femoris.
How about biceps femoris?
Oh, biceps femoris.
Cool.
My bad.
No problem. All right, let's keep moving up. What are the 3 gluteals?
Gluteus maximus, medius, and minimus.
Good. What are the 3 erector spinae muscles? Running up the back.
Longissimus, spinalis, Called the iliocostalis.
Yes, iliocostalis. All right. All right, we're going to give you a break. You kind of catch your breath, eat a little more cotton candy, talk to your dog.
Yeah. I actually need to go drink some water.
And we'll come back to you. I love it.
Thank you.
Thank you. Very good. Miss Lee.
Hi, I'm here.
Hi. It's probably nerve-wracking being called on. Don't worry, Miss Lee. Miss Lee, do you know the name of the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
Wow. Do you know the name of the 3 hamstring muscles?
Biceps femoris, semimembranosus, semitendinosus.
Wow. Do you know the 3 gluteal muscles?
Gluteus maximus, gluteus medius, gluteus minimus.
Yes. Do you know the 3 erector spinae muscles?
Spinalis, longissimus, iliocostalis.
Thank you, Miss Lee. Well, I think we're going to stop right there. I could not have pronounced those better myself. That was absolutely perfect. Thank you, Miss Lee.
Thank you.
Really impressive. Oh my gosh. Okay. Moving right on. Miss Suriel.
Yes, Mr. Tapscott.
Miss Suriel, can you tell me the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
Great. Can you tell me the 3 hamstring muscles?
Hamstring.
Yep, in the posterior femoral compartment.
Is that the vastus lateralis?
No, that's in the front. I mean, it's actually on the side. But anyway, yeah, these are in back, so it's a semi...
Oh, okay. Semimembranosus, semitendinosus,
and a 2-headed muscle found on the femur.
and biceps femoris.
Yes! Can you tell me the 3 gluteal muscles?
Gluteus medius, gluteus minimus, and gluteus maximus.
Thank you. Can you tell me the 3 erector spinae muscles?
3 erector spinae muscles are the one in the back of the...
Yeah,
okay.
they run up your spine, basically.
Oh my God. Is the longissimus, iliocostalis, and I forgot the last name.
And the other one it attaches to the spinous processes of the vertebrae.
Hold on. Longissimus. Spinalis.
Spinalis! Perfecto. Thank you. Thank you, Ms. Suriel.
Thank you.
Very good. Let's see. Miss Carrillo. Yeah, calling on you.
Yes, Master Chef. What's going on?
All right, Miss Carrillo. Let's step it up a level, okay?
Oh no, I didn't sign up for that.
No, you didn't. Miss Carrillo, what are the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
What are the 3 muscles found underneath them?
Flexor digitorum longus, flexor digitorum hallucis.
Flexor hallucis longus.
Oh, flexor, hallucis longus, and tibialis posterior.
That's beautiful. What is the funny little diagonal muscle found in the popliteal region in the back of the knee?
Popliteus.
Yes, the key that unlocks knee. Thank you. What are the three hamstring muscles?
Biceps femoris, semimembranosus, semitendinosus.
And here's where we're going to step it up a little bit. Which one's most lateral?
Biceps femoris.
That is correct. Thank you. I know, by the way, this is the most nerve-wracking thing that anybody can do to you in the world. If somebody was doing it to me, it would bother me. But they're not, because I'm the teacher, so, sorry. Sucks to be you guys. Kidding. Totally kidding. Which of the four hamstring heads does not cross over two joints?
The short head of the biceps femoris.
Yeah, not long enough to go over both joints. And so the short head of the biceps femoris only has one action. What is that one action?
Flexion of the knee.
Yes! It only crosses over the knee, and it flexes the knee. You're doing really well. What are the three gluteal muscles from posterior to anterior?
Gluteus maximus, gluteus medius, gluteus minimus.
Cool. Which one is primarily a powerful hip extender?
Gluteus maximus.
Yes. Which one is primarily a hip flexor?
Gluteus minimus.
Yes. Which one is primarily a hip abductor?
Gluteus medius.
Yes. What are the three erector spinae muscles from medial to lateral?
Spinalis, longissimus, iliocostalis.
Yes. What are the shoelace-like muscles that are underneath those?
The multifidus and rotatories.
Yes. Let's stop right there. That was really, really good. Thank you. Thank you, thank you.
Thank you.
What's that, Miss Ablos? You feel left out? Okay, you can go next. Miss Ablos.
Yes.
Miss Ablos, what are the 5 abdominal muscles?
Your rectus abdominis, transverse abdominis. You have your internal, external obliques, your quadratus lumborum.
Awesome. Really well done. Which one of those is, by the way, there's quite a few that are actually, but which one is primarily responsible for a flexion of the vertebral column?
The rectus abdominis.
She's 100% right, everybody. Good. Which one of those is primarily responsible for an extension of the extension of the vertebral column?
Your quadratus lumborum.
She's exactly right. It's in back. It does that. Which one of all of those is primarily designed to compress the entire abdominal compartment?
Transverse abdominis.
Yes, it acts like a belt around you and compresses the entire abdominal compartment. By the way, creating a tight belt around everything. It's kind of your weightlifting belt. That's really good.
Well, they say it holds your core. So once you lose it, you lose core power. So overall, your energy overall is going to be weak.
Yeah, you're shot. Yeah, well said. Very well said. All right, this question's hard. If I do a lateral flexion of my vertebral column to my left, lateral flexion of my vertebral column to my left, what muscle or muscles are involved? Abdominal muscles or muscle or muscles is involved in that?
Your internal and external obliques. For the same side, for unilaterally. But it's like my mind's jumbled when you said lateral flexion because I started thinking like erector spinae, internal, all of them. So the psoas major came in.
Oh yeah. You're doing fantastic. You're absolutely right. That's why I stuck with abdominals. But
Okay.
you are right, madam. By the way, you're right. So is there another abdominal, by the way, involved? By the way, she nailed it, everybody. She picked internal.
Well, the quadratus lumborum.
Thank you, on that side too. She picked internal, external obliques on this side because if they both pull, I go over. And she got the quadratus lumborum on that side too. Really, really
But the
well done.
erector, it's the erector spinae,
Oh, God, yeah.
internal obliques. It's the psoas major, quadratus lumborum, and the transversary spinalis group.
Yes. Okay. Wow. I actually had to
That's
think about
what
her
it
answer.
is.
Yep, she's right. Yeah.
Yeah.
You're right. All unilaterally.
Right, correct.
Yes, all unilaterally on that side. So, Miss Ablos, thank you. By the way, thank you for displaying to the class where we're headed, right? This is what we want to do with anatomy, is the ability to then say, these muscles have to be involved in this movement. So if somebody's stuck in that, we kind of know that these are the muscles that could be a culprit. If somebody's having a hard time moving that way, it could be the opposite muscles, things like that. But this is kinesiology. You did a beautiful example.
Well, it's starting to get to a point now in my studies where I don't want to isolate to one area. So it's all connected. So I've been reading the train book, and now my mind
that's
is
right,
starting
the
to
train
think past what question you're asking me. So it's automatically happening now, which is kind of cool.
It's, I would say, extremely cool. Thank you, ma'am.
Thank you.
That was really well done. Thank you, thank you. Okay. Mr. Richards. Hi.
Yes, sir. I
Uh,
want to move in with Atlas. I want to move in with her, spend my days with her. I would learn so much.
have her quiz you over, yeah. You'd be eating, she'd be like, what muscles are you using?
Yeah,
You know?
yeah.
And you'd list off all like the masseter and the pterygoids and, the temporalis. And she'd be like, no, also the wrist muscles that you're using to eat and everything. Yeah.
Can you feel the energy flowing away from them? Can you feel the tension releasing from them? Can you feel the fibers lengthening out while you do this move?
I love
Yeah.
it.
What nerve you're activating?
I love it.
Yeah. So if you've got a spare room, I'm down.
I love it. Cool. Hey, sir, what are the four muscles that are found on, what are the four quad muscles that are found on the anterior and lateral femoral compartment?
There we go.
I apologize. What are the four quad muscles? I mean, quad means four.
Vastus medialis, vastus intermedius, vastus lateralis, and rectus femoris.
Yes. So all those are found on the front of your leg or the side of your leg, both. Vastus lateralis obviously found on the side of your thigh. But anyway, they all insert where?
Into the patella?
Yes.
That's right.
They all insert in the patella. Don't say pes anterior. They all insert in the patella. And then where does the patella insert?
Into the pes anterior, right?
I hope not. Pes anterior is on the side of your leg.
Oh, tibia, right?
Yes. So they all insert into the patella, and the patella is attached to the tibial tuberosity, the bump on the top of your tibia that you can feel right below your kneecap. And that allows you to do what? What action do they create? Because they reach over your knee and grab onto your leg. What action does that cause?
Flexion. Flexion of the knee. It's my favourite word.
Yeah. It's not my favorite word anymore.
No. I'm trying to think now. So if they pull, extension.
Yes. That's the one that's in front where it's usually, yeah. Anyway, extension of knee. Cool. One of those muscles crosses over two hip joints. And I just gave you the answer. One of those muscles crosses over two joints. What is that muscle? One of the four quads crosses over two joints. Doesn't just cross over the knee, crosses over the hip.
Rectus femoris.
That's right. Rectus femoris actually has an origin on the anterior inferior iliac spine. Anyway, because of that, what additional action can the rectus femoris perform, sir?
It can do anterior tilt.
Yes. Anterior tilt, which is also the same as saying what?
Flexion.
Flexion of the hip. Cool.
Yep.
Yep. Yeah. Beautiful. By the way, you're 100% correct. That was beautiful. Thank you, sir. That's good. That's good. It's really hard to pull out that kind of information from just out of the blue. Hey, Miss Rader, can you tell me the 5 features of the temporal bone?
Yeah, the external auditory meatus, the styloid process, the mastoid process, the zygomatic process, and the temporal mandibular joint.
Cool. Can you tell me the 4 muscles that attach to the mastoid process?
The splenius capitis, the longissimus, the digastric, and sternocleidomastoid.
Cool. And the digastric kind of falls in what muscle group, just so I know what we're talking about? I've never asked this way before.
The suprahyaloids.
Thank you. I apologize, by the way, that we're kind of throwing stuff at you in a very weird packaging. Suprahyaloids. Okay. Is there another, and you don't need to know the name of it, I told you guys you didn't need to know the name of it, but is there another suprahyaloid muscle that attaches to the temporal bone?
Yes. The
And you don't have to,
the stylohyaloid.
yes, you even know the name of it, which means you know where it attaches.
Yeah, the
It-
styloid process and the hyaloid.
That's why the styloid process is there, everybody. It's for that muscle to attach to. Yeah, very, very cool. Awesome. Thank you, man. Cool beans. Okay. Miss Dimitruk.
Yes.
Can you tell me the 4 muscles that are associated with chewing? Which we call masticating.
Sternocleidomastoid longissimus.
Whoa. Chewing.
Oh, wait.
Chewing.
Well, the mastoid.
How about the masseter?
Okay, I can't tell you then. A masseter and pterygoid.
Yeah, pterygoids,
Pterygoid.
medial and lateral.
Yeah.
And then I'm gonna rub my temples while you think of this next one.
Temporalis.
Oh, that's it. You got them all. Good. So you got the temporalis, masseter, lateral pterygoids, medial pterygoids. Yeah. So what were those 4 muscles again?
The masseter, the lateral and medial pterygoids.
Just say pterygoid. Pterygoid.
And temporalis.
Thank you. Thank you, Miss Dimitruk. It's always a pleasure. Yes. Love it. Oh my gosh. Mr. Bose. Hi. Hi, Mr. Bose. Well, while you're swallowing there, I'm about to ask you what the 5 hip adductors are. These are the ones found in your medial femoral compartment between your thighs. They make up your middle thigh. The 5 hip adductors.
Adductor longus.
Adductor longus, yes.
Adductor longus, adductor brevis. Hold on.
So you got long, short, now we need really, really big.
Adductor magnus.
Adductor magnus.
It's AD, right?
Yeah, because they're added, they pull your legs together. They add them together. Yeah. So adductor longus, adductor brevis, adductor magnus. Cool. 2 more. One starts with a G and one starts with a P.
Is it gracilis?
Gracilis, yes. And what's the other one that starts with a P? P, E, C, T, I, U, S. I think I just spelled it. P,
I don't know what that
E,
but I'm thinking of
C.
the one.
what?
What?
I'm spelling it.
P,
P, E,
E,
C,
C as in cat?
C as in cat,
TEC.
T
Mm-hmm.
I.
Oh, pectineus. Wait.
Pectineus. Cool.
Yeah,
All
pectineus.
right. So what are those five muscles?
Gracilis, pectineus, abductor magnus, abductor longus, and abductor brevis. Oh yeah, I forgot about those.
I love it. That's all right. It's been a while. That's why we're doing this. I don't do this to annoy you guys. I do it because you guys have learned so much that we forget.
Yeah, I forgot about pectineus.
All of those cross over from the femur to the hip. That's how they work. If you don't cross over a joint, you can't close that joint. So they're all adductors of the hip, and so they all cross over the coxal joint, the femoral acetabular joint. They cross from the femur to the hip. Which one or ones of those cross over the knee as well? And insert into the pes anserinus found on the medial proximal surface of the tibia? This is a hard question, but one you guys should know.
Yeah.
It would have to be.
Is it your gracilis?
It is, ma'am. Very good. And it's only your gracilis. And it's important to remember because many things insert into the pes anserinus section, and it has to do with knee stability. And so that's why we care about it. For $5,000 additional dollars, can you tell me the other two muscles that insert into the pes anserinus? You already got the gracilis. These aren't adductor muscles. There is a hamstring muscle that inserts in there, and there is a lone wolf, the Taylor's muscle, that inserts in there too.
I could guess.
Go for it.
Your semitendinosus.
That was a very, very, very good guess. So we have the semitendinosus and the gracilis. Can you tell me what the Taylor's muscle is? It's a giant diagonal muscle. I think it's the longest muscle in your body. Runs diagonally across the front of your...
Sartorius.
Yes. Good. So what three muscles insert into the pes anserinus?
Gracilis, your semitendinosus, and your sartorius.
Cool. And what were the 5 hip adductors again? And then we're all done.
Adductor longus, adductor brevis, abductor magnus, gracilis, and pectineus.
Very nicely done. Thank you for hanging in there with me. Really good. Thank you, ma'am. That was good. Mr. Godot. Same question, sir. Mr. Godot? Going once? Mr. Godot? No?
Hi.
Oh, good. Mr. Godot, same question.
Can you say... Okay.
What are the 5 hip adductors?
Sorry. Yeah, I'm not gonna lie. Can you repeat that one for me?
Yes, what are the 5 hip adductors?
Okay. I know. Okay, so the brevis, the longus.
You've got, by the way, now you've got several brevises and lots of brevises and longuses in your body. What kind of brevis?
Okay, so
there's more to the name.
There's adductor brevis, adductor magnus, the gracilis, pectineus.
Yep.
And the adductor longus.
Yes. Okay. So all of those cross over the hip joint to create an adduction of the hip. One crosses over the knee joint as well. Which one is that?
So you said one crosses over what?
One crosses over the knee as well. Which one is that?
I want to say the gracilis.
The gracilis. Yes, sir. And where does it insert?
I don't know. Can you tell me that one? And then I will
It
remember
inserts
forever.
into the pes anserinus, along with two other muscles.
Okay. Pens and serratus.
Yes, which is on the tibia. But
Okay.
do you know what the other two muscles are that insert there?
Sorry, my mom is wrong. Let's see. The Santoris?
Sartorius, yep. And
And
the
tendinosis.
Good. Okay, good. So let's review. What are the 5 hip adductors?
So they are the pectineus, adductor longus, gracilis, adductor brevis, and adductor magnus.
I think that's right. Good. Okay, cool. Since I got you on the line, sir, let's go over some basic review. What are the 3 calf muscles?
So there's this soleus, like from the leg up.
Well, they're. I don't understand your question. Like,
Well, you said the 3 calf muscles. Well,
yeah.
okay, well, my bad. I was doing from the bottom of the foot up. Sorry.
Well, they do run kind of to the heel, all of them. But just the 3 calf muscles.
The plantaris, soleus, and then gastrocnemius.
Cool. What are the 3 hamstring muscles?
The semimembranosus, bicep femoris, and semitendinosus, bicep femoris, and
Another semi.
semimembranosus.
Good.
There we go.
Semimembranosus, semitendinosus, bicep. Good. What are the 3
That's
gluteals?
ironic.
What are the 3 gluteals?
Gluteus maximus, minimus, and medius.
Cool. What are the 3 erector spinae muscles?
It's still going up.
Yeah, they are.
The spinalis, sorry, and then longissimus and iliocossalis.
Good. What are the 4 quadriceps femoris muscles found in the anterior lateral compartment of the leg?
Are these the
Yes, sir, they are.
Okay, cool. All right, vastus medialis, vastus lateralis, vastus intermedialis, the sartorius, and rectus femoris.
Yeah, rectus femoris. Sartorius isn't one of the quad muscles, but it is in that area. You are right.
Oh,
there.
well.
Yeah.
Whoops.
It just does something completely different. But that's good. Sartorius is over the top, too. Okay. And what are the 5 abdominal muscles? That's it.
Okay, so there's the oblique. You need the whole name?
Yeah.
Alright. Sorry. So there's the internal obliques, the external obliques, the rectus abdominis, and then transverse abdominis.
Good. That's 4. Give me the 5th one. It's found in your back, actually, strangely enough.
Oh, the QL.
Yeah. What does QL stand for?
Quadratus laborum.
You said it, sir.
Yeah?
Just say it again.
Quadratus laborum.
Yeah. Good. Okay, cool. Everybody, let's take a break. We'll be back at 9:45. 9:45, everybody.
All the names of the other ones.
That's okay.
Oh goodness, what was the names of them? It was the medial and the lateral one.
No.
Terry.
No.
Not the pterygoids?
No.
Okay.
If we only had a really long back muscle that could also attach there to kind of balance this one out in front.
Oh, is that the longissimus?
Yeah, so the longissimus and the sternocleidomastoid, they can fight each other, everybody. And then if I had kind of a diagonal muscle going from my spine to my head, from my spine to my cap.
The trapezius?
Well, from my spine.
Diagonal.
I'm trying to tell you the name. From my spine to my head. From my spine to my cap. Maybe we call it.
Oh, spinalis.
Well, no. How about we call it splenius capitis?
Oh.
Yeah. And then we learned a super. It's okay. And then we learned a suprahyoid muscle called your
Digastric.
digastric. Also goes there too. Cool. You're done. Thank you, ma'am.
Okay. Thank you.
Thank you. By the way, question for everybody. If I wrote the final, how likely is it that every time I quiz you on something, it's really a final question? Even if I wasn't trying to do that. Wouldn't I just kind of regurgitate that stuff? So when I ask the muscles on the medial border of the scapula, and when I ask what they argue with, and when I ask these things that cross over the knee and the shoulder and actions, that's your final, right? I mean, I don't know that I haven't looked at it in a while, but I'm the one who wrote it, so it's very, very likely. So you should be prepared if you find these reviews fairly easy. If you find them very hard, you need to study. But that, just to give you kind of a heads up, because a lot of people are worried about the final, and actually you've been listening to the final for 7 months, or at least some of you have. All right, let's talk about facial expression muscles. And we'll release homework too soon, because I promised you guys when we get to homework and you would not have to do it over the weekend. Because I know that you guys have other things to do over the weekend. Yeah. Okay. I love it. Okay. So here's a face. We're actually not going to be really talking about, well, we'll talk about some of these muscles in this picture. So, facial expression muscles. Facial expression muscles in general do not discuss origin and insertion. Why? Because they don't have an origin and insertion on a bone. Most facial expression muscles are literally woven into the skin. So your whole body is like a giant fascial sweater. This is where you start to get into advanced kind of stuff Ms. Ablos is actually talking about, fascial lines and trains. Your body is really actually a big suit of woven fascia with some of the fibers able to contract. Instead of thinking about the muscles separate, that's how we teach you in the beginning, but in really advanced body mechanics, we understand that I have this giant body sweater on, and some of the sweater fibers are just stretchy and elastic, that's fascia, and some of the sweater fibers can actually contract. And so in your face, you've got these contractile fibers built into your face. They are not structural. They don't help your posture or anything, at least not directly. We have discussed the fact that your face tells your body what mood you're in and stuff, so they're very important. But something to think about from a caregiving point of view, from an interacting with other human beings point of view is, why do we have so many facial expression muscles? And it's because faces are extremely, I'm sorry, faces, she's like, I thought it was a question. It was a question, I apologize. Faces are extremely important. Faces are extremely important. And what happens when you meet somebody is you read their face and hardly listen to anything they say. You could actually say the meanest thing to people if you just smile and you're like, you guys are a bunch of jerks, but you smile at them like this, it doesn't even feel that way. And you can say the meanest thing in the world, I mean the nicest thing in the world, and if you kind of are like, I really love you guys, it just doesn't have that feel to it, right? So please, in going through this, I don't care if you memorize any of these muscles, but I want you to remember how important your facial expressions are, especially when you first meet a client. They've got all sorts of self-image issues they're bringing in. They've got all sorts of baggage because they're like you and they're like me. Remember? And that first glance you give them is really key. I actually kind of bring myself up and make sure I'm like, hi, how are you doing? So happy to see you. Because that person is waiting for disappointment at that point. They really are. Facial expression muscles are key, and we actually communicate way more with them than we do with words. Totally, totally, totally true. Mr. Singletary, you raised your hand.
Yeah, I was going to say it's another form of nonverbal communication.
Yes. And nonverbal communication is actually more prevalent in human interactions than verbal communication. Right? People remember the way you make them feel, not what you say. So let's look at this really quick. The whole point of this entire lecture is that you can kind of guess the names of these things. So, like, if we have a muscle that goes around the eye, Has anybody looked through binoculars? Oculi means eye. Orbicularis means the circular orbiting muscle around the eye. Orbicularis oculi means that muscle, right? So they kind of make sense. Labia means lip. Labia means lip. You've got a labia around your glenohumeral joint that helps hold it in socket there. But you actually have lips right here. And you've got things that might elevate your lip. Well, we've got a levator labii, the lifter of the lip, right? So these things actually make a lot of sense, and most of them you really don't have to memorize. Like the nasalis is actually over your nose. Okay, I am going to go through them piece by piece, but I just wanted to point out, that they all kind of make sense. And auricularis are your ear muscles, right? The auditory muscles. Okay. Buccinators. Buccinators don't really follow what I just told you, but buccinators literally allow you to pucker like this. Yeah, use them when you blow a horn. Use them when you do a little kissy-kissy. Uh-huh. Yeah, that's probably what you're doing this weekend. I know. Uh-huh. Yeah. One can only hope. Buccinators. They really do help you kind of pucker. If you think about it, your face does some really intricate stuff. It's really quite impressive. Buccinators. Depressor anguli oris literally means the muscle that depresses, pulls down the angles of the mouth, the edges of the mouth. I love that some of you are making these facial expressions with me. You can actually feel the muscle going there. A little depressive. And then I kicked in my platysma. I couldn't help it. Kind of started doing that. But anyway. But the word kind of says it all. It's kind of cool. Depressor labii inferioris. Depresses the lip, and it's on the bottom. It's the inferior depressor of the lip. In case you want to show off your bottom teeth. This is an attractive look. Yeah. You've got levator anguli oris. It lifts up the angles of the mouth. Levator, lift. Anguli, the angles, the edges of oris, oral, mouth. Boom. Yeah. Yeah. I wish I was taping you guys right now. Ms. Hendrickson.
I don't know where I read this, but that like most facial expressions are symmetrical, but contempt is the one that's asymmetrical.
Oh.
You lift one corner of your mouth like.
Oh, I like that. Yeah, it's quite possible. Yeah. This is what they study when they videotape people look for micro expressions, because they say your face can't lie. And you make these really quick little things, and they can actually see contempt or whatever, things like
Have you
that.
seen that show Lie to Me?
Yes, it's supposed to be a guy that can actually see him. Yeah, that would be terrible. Yeah. Anyway, the mentalis. Think of the thinker, mentalis. I can't do this one. I'll let you guys work on that. Mentalis. This is a sphincter muscle. The orbicularis oris, right? It's your oral sphincter muscle. We have sphincter muscles all over our body. I know there's also jokes about them, but this is one of your main sphincters. And it is very similar to the one in your butt, by the way. They're meant to draw in and close. Right? We already talked about the platysma. Has no origin insertion, really. It's inserted into tissue. Yeah. Pulls everything together. I love that one. The rhizorius, kind of pulls back stuff there. Oh, the zygomaticus major. This is the Joker's favorite muscle. Yeah. Joker's got a favorite muscle. Zygomaticus minor. Because anytime there's a major, there's always a minor. Anytime there's a lateral, there's always a medial. Anytime, Yeah. Kind of cute. I love this one. Do you ever see your cat do that, Miss Hendrickson, when they do that thing with their nose? They don't like the smell of something?
Yeah. Every time I use like my icy hot or something, she like runs over and I let her smell it. She's like,
I know. They're just completely disgusted. Yeah. This is, by the way, called, I hope I say it right, but it's called the levator labii superioris alique nasi. And I'll never say that again for you guys. That's it. The nasalis. I love this one. I actually massage this on clients. Because I think it opens up their sinuses. That's why I do it. I actually kind of push it up there. Savos has a circular motion when she does it. I like it. She really gets in there. It's awesome. Very cool. Procerus. Helps you frow your brow there a little bit. I love this one. The corrugator supercilii. You know, corrugated aluminum that's all rolling? This is what this does. It corrugates that stuff and rolls your little thing. Corrugator supercilii. It's like they made it up. I love it. I mean, somebody did make it up one day. These names, I know. Again, another sphincter muscle, orbicularis oculi, instead of oris, right? It's for your oculi. You guys are the best. We already talked about the occipital frontalis. Occipital frontalis, by the way, is woven into tissue, but there's a whole bunch of muscles that attach into that tissue, so you can kind of argue that it has structural importance. But anyway, it also helps you raise up your eyebrows. The Rock would not have the career he does today if he did not have this muscle in full control. Yeah, it's true. His career would be over. This muscle is very interesting. So if you believe in evolution, this muscle is kind of left over from when you were like a dog and you could turn your ears around like dogs and cats do. This allows you to raise your ears, lower them. Some people can still control this muscle and they'll move their ears and stuff. I can't do it, but it's really cool when they can. Like, that's a life skill. That's what we should all be working on. But it's something else you can massage. Kind of cool. And they'll use this as a test sometimes with people when they think they have hearing problems and they don't know if they're actually hearing, because these muscles flex when they hear sound. They try to pull your ear towards the sound a little bit. They still operate. Up, and that's it. That's it. It's inside of a head there. So, as promised, I'm releasing homework. And so I'm trying to release homework. Bear with me. It's coming. You have 2 homework assignments. I really believe they can be done in the remaining time of this class, if you so choose. So one is on facial expressions, and one is Introduction to Chapter 3, which is in the trail guide, which is hands and forearms, which we saved to last because they're not very structurally important, but I have to tell you they're super, super cool. The fact that my hand can do this, by the way, is just utterly amazing. But the fact is that some of those muscles are coming up here, and that I can control my fingers and still bend my wrist and still control them and even do that movement while I'm bending my wrist, means the length of these ropes is changing and my brain has to make adjustments for all that. It's absolutely amazing. Your hands are puppeted from your forearms. Your hands are puppeted from your forearms. They're basically strings down here or point on them. And they're very similar to the feet. So anyway, we will be... I love that look, Mr. Truck. It's very pondering. Anyway, you have 2 homework assignments. You got time to work on them. And then we will be next week starting to work on... we will... You guys are so distracting. I'm glad you have your cameras on. But I love it. Next week we'll be starting the hands and forearms. I'll come back and check in on you. Do your homework. Eat your vegetables. I'm going to silence myself. Yes, I know. Don't be so enthusiastic about it, okay?